Hello everyone, this is Pravida from Neethus Academy. If you are preparing for the Occupational English Test, today's video is going to help you to boost your score in the writing session. So welcome to this quick guide on how to express a patient's medical condition or diagnosis in different ways in your introductory part of the OET letter writing. As you all know that using the correct tense and phrasing are essential in conveying the clear and professional information. So now we will go over various ways to say it, especially focusing on the different tenses, and you can choose the correct suitable form depending on the situation. So without further ado, let's begin with simple present tense. He or she has orthostatic hypertension. He or she has type 2 diabetes mellitus. These statements describe a current ongoing medical condition that the patient is experiencing at the moment. If you want to express a long-term health issue or to describe patient's current medical status in a more straightforward manner, you can convey it through simple present tense. Present continuous tense. He or she is recuperating after an appendectomy. He or she is recuperating after left hemiarthroplasty. Recuperating after refers to a gradual recovery, often focused on the rest and restoration. അതായത് ഇത് നമ്മൾ യൂസ് ചെയ്യുന്നത് in order to describe the healing process after surgery or medical procedure. That means if a person has undergone any medical procedure or surgery and is in the recovery stage, which is their current medical condition, it is better to describe as recuperating after. He or she is recovering from pneumonia. He or she is recovering from right angle fracture. In this context, recovering from refers to the process of healing or regaining health after an illness or injury. It emphasizes that the patient is in the process of overcoming the effects of that particular medical condition and the journey back to their normal health. Present perfect tense. Present perfect has been, that is in the passive voice, in patient's diagnosis can be employed when the medical issue is not resolved yet. That means the patient is still having the condition which is not yet completely managed. For that purpose, he or she requires further assessment, evaluation or treatment. Let's see it with an example. I am writing to refer Mr. Alan Evans, who has been diagnosed with myocardial infarction, requires further assessment and management at your facility. Simple past. Was diagnosed. This action is employed when a medical procedure has been successfully carried out without any complications. It refers to a situation where the condition has been controlled through proper medical treatment or medication, meaning it is no longer worsening and is now stable. Let's see the example. I am writing to refer Mr. Christopher Ryan, who requires ongoing care and management. He was diagnosed with chronic obstructive pulmonary disease. He is said to be discharged today. Suspected case, passive voice or simple present tense. Sometimes you may need to refer a suspected diagnosis. On the basis of the symptoms or test, there is a possibility that the patient might have this disease condition. Since the diagnosis is not yet confirmed, in this case we can use is suspected to have with the medical condition. Let's see it with an example. I am writing to refer Mrs. Jennifer McLaren, who requires further evaluation and management to find out the definitive diagnosis. She is suspected to have Horner syndrome. When writing an OET letter, it's crucial to match your tense to the patient's current status. So be careful about whether the condition is in the past, ongoing, suspected or being treated. Remember to practice this variation and use the correct tense depending on the situation. And stay tuned for more such OET tips, and as always, leave your questions or any other topics you would like us to cover in the comments below. Good luck with your OET writing, and I will see you in the next video. Thanks for watching. Take care.
Neethus Academy, India's #1 language academy.